Dr. Mola, all these things that you have revealed over the following the on Monday after the long Easter weekend, what was it like?
Well, it was in fact like a typical weekend in some ways.
Yeah.
I mean, but when you're in the middle of it because you just happen to be on duty for the emergencies, I'm the sort of the backstop at the end. It's not as though I'm sitting in the hospital for the 72 hours. You understand?
Yes.
All my junior trainee specialists are there on 8-hour shifts, who are there, and I'm their backstop, so that when they have a big problem, they ring me up and I give them advice, or sometimes I have to go and give them a hand.
Sure.
So this just brought home to me once again the fact that the maternity section of PMGH is not coping. Now, we've seen the trajectory of the volume of how much blood Mary, Sikh Mary, I call him Gynecology, and Mums Karim Belia, na problem, Bell, or one name, na Karim Pignini, Obstetrics and midwifery.
Yes.
And we've seen the trajectory, numbers he walked on top, all get a year. Me start PMGH as a young doctor in the 70s, in my training period, when we had about 6,000 births per year. That's like 500 a month.
Yeah.
So it's gone on up. It goes up about between 8 and 10% every year. And so last year we reached 17,000. And
wow.
The facilities at PMGH were the new labour ward, the new postnatal ward, the old antenatal ward, and the Susu Mama Clinic Tamblu, where Mama Sakam skilled in Belno, Mary Sakam check up, outpatient, the problem.
Yes.
That was back in the 1950s, of course. It used to be what we called the European hospital. And then time below self-government, about 73, 74, all change this come up all same section below Mary, like take over along European hospital, kind of same. So the numbers that we built with the renovations and the additions in 1981 to handle a maximum of about 9,000 or 10,000 a year.
Yeah.
But we started to exceed that number back in the 90s.
Yes.
So we started to warn governments even before we exceeded, because we could see the trajectory. Yeah, you can look at him, you may go where, numbers he walk to go where, and walk to go on top of the yeah. So people have warned him, Julius Chan government, people have warned him Pius Windy government, people have warned him Michael Samari government, people have warned him Bill Skate government, people have warned him Rabi Namalu government, all get the government, people have warned, he must got more birthing services like this city, yeah. Because it's not reasonable that just everybody comes to this one public institution to get the quality birthing care they need, so their baby survives and they survive too. And good to have a nice experience as well, you understand. It's not, birthing is mostly not a life-threatening situation. It can turn in from normal to, a woman can go from being a normal, healthy young person to dead in a matter of 3 or 4 hours when things go wrong.
Yes.
So uterus ruptures, or she just starts to bleed and we can't stop it, or something like that. So it's the only medical specialty where this is the case, really.
Yes.
If you're doing ophthalmology or eye doctor or ENT or some Yao Nuz Neck Doctor or this like Nabla Doctor, all these colleagues have time to deal with their problems. Usually, there's an interval between when the patient starts feeling a problem with their hearing or their their lungs or their heart or something. Heart attack is a bit sudden sometimes, but even stroke, it's blood pressure, and if you get your blood pressure checked, you're going to head for a stroke unless you deal with it, so you have a warning.
That's right.
But in our specialty, in this obstetrics business, a healthy young person having a normal pregnancy If she starts bleeding, she can go from healthy, young, normal person to dead in 3 or 4 hours. And so it's a very challenging specialty that we have to be alert all the time.
Right.
So to have this enormous volume of women coming is a big challenge, to keep your eyes on everybody, to be alert to everybody. And when women are on the floor,
yes,
now we're getting to on the floor issue, okay,
which has been the case,
which has been the case now for several years, and we've been warning the PMGH and the National Department of what's it called, the NCD, Provincial Health Authority, that this is what's happening. If you come to PMGH, you might end up on the floor. So if you've got any money, why not spend it on yourself and get something
from the private,
in the private sector? If that's what you can afford, please do so. You know, when you come to this city, you have a choice, don't you? You can stay at the what's it called, the Airways Hotel or the Holiday Inn, or you can stay at the Koki Market
there you go.
Lodge or something. Like Blayu, how much resources you got, where you choose. Well, I think people in the city need to choose too where they're going to have the baby. If they've got resources, choose the best place for yourself, because at the moment it's an enormous challenge for us in the public sector. You know, there's so many people who have no choice really, because they have no financial resources to make the choice.
Yes.
And so we have to look after them. The poor things that have no capacity to make choices. We have to look after them. That's our priority.
Yes.
So on the floor now. When you're on the floor, it's really difficult for the nurses and doctors, midwives, etc., to provide quality care for you.
Yes.
It's difficult for a nurse to kneel down on the floor, which is sometimes not clean to start with, because someone's just had a baby there recently, and then you're having your baby, so there's liquor, there's blood, time mama shubin baby, pek tuisa come out, and then pis. And so how by nursing kneel down the floor on top of pek pis blood, liquor? It's just not reasonable.
Yes.
So she might be bending over to try and help you, but she can't really see what's happening properly. She can't access your birth passage
That's right.
to make sure you don't rupture your anus or something in the birthing process and get a terrible complication for the rest of your life. So, and then even on the commonest time that women die with birthing complications is after the baby comes out, because that's when the bleeding occurs. And
yes.
And so to stop the bleeding in a woman who's had a baby 1 hour ago or something, and then she starts bleeding heavily, and if she's on the floor, I mean, how to get the drip in, how to get the catheter in, how to check that there's no retained bits of rubbish in the uterus, how to sew up any tears that might also be bleeding and contributing to the bleeding. It's just not possible. And so substandard care is expected if you're on the floor.
Yes, yes.
And we don't want to be expecting substandard care in our national... we're meant to be the best, surely. We're meant to provide the teaching of how to do it properly, and then we're meant to show an example of best, so that all the rest of the country can see how it can be done best.
Yes.
At the moment, we're not able to do that. So we have to have a way out of this mess. It's a mess. I'm sorry. It's a mess, government. And it's not James Rabi's government. They've copped the mess. I mean, here we are. We just happen to have a James Rabi government at the moment, and we're in the middle of this mess. And we're very much looking forward to collaboration with the Minister, and the Prime Minister too has expressed some concern, I hear.
Yes.
I've heard
That's good.
from some colleagues that he has expressed serious concern about this mess, and talking to his health minister and other important people in National Department of Health to start listening to the women's health specialists. One of the problems recently is that management has not been listening to the women's health specialists and the newborn health specialists because they have their own vision. And their own vision is mainly focused on tertiary, high-tech, referral type of issues, which is important. I'm not downplaying the importance of that agenda.
Agenda, yes, yes.
But that agenda is for a tiny, tiny minority. Only less than perhaps 1 in 100 or 1 in 1,000 women in our section end up requiring that sort of care.
Right.
And best to prevent, I mean, one of the axioms of walk doctor, or same kind, doctor is a karmapi morketa walk doctor, or maybe hospital walk doctor.
Yes.
And we also prevention is better than cure. On that principle, we need to be addressing quality primary care and quality secondary care before we just address quality tertiary care. So that when you're designing the best education system for the country, you don't just build universities. Because if there's not good primary schools and good secondary schools, who's going to go to university? You just have empty universities if you don't have any primary quality secondary schools. Or you'll have head diwa or line in Nogat Theoretical University, but hard law school in more long tertiary education there.
Same concept.
Same concept there. So please, let's be sensible about this. And in the past we've had this mantra, or say talk. Igotasol.
Yes.
Doctor Igotasol. And more Buddhist there, doctor over in talk saying something over and over again.
Yes.
Some of the time people are Christian too, is Lord's Prayer about 10 time now. Have nice, yeah. So health planning, we can't just have a mantra of we're going to do tertiary care because Prime Minister or Minister or who's that there talking people about tertiary care. You, as a leader, you need to give feedback to your political policy makers.
Yes.
We have to have sense as well as, yes, boss, we need tertiary care, but we also need quality primary and secondary that leads into functional tertiary care. And so that's where we are at the moment, that we have to work out the best plan for this national capital. So that means collaborating, of course, with the National Capital Health Authority. They're a separate executive organization.
Yes.
We're not under the same boss. You got same level, tubla boss, yeah. You got CEO blow NCDPHA, and then we got CEO blong PMGH.
Right.
And tubla one time you got separate board, so tubla separate organization look at that. So all you must collaborate, integrate our planning, and make sure we get it right.
Yes.
For the families of this national capital. And this national capital is really very challenged. It's difficult to do education planning. It's difficult to do health planning because, how much money will come inside of the city a day? Yeah.
Every day.
And we don't even know that, actually. How many people get off the plane at Jackson's every day and they're only here for a weekend or something? And how many get off the plane and have no return ticket and and then all these buses that come from Iritano Highway or Magi Highway or whatever, Sugeri,
Yes.
How much slowly come lo? Just look him boo-boo or look him uncle or something. Nah, think lo go back lo next month. Now how much slowly come lo? Like stop the soul, yeah. We don't really know. But there are thousands of people coming to this city every day. And in government and policy and the people who are planning for all this, unless you've got the data, it's really difficult to know what to do. But we have the advantage in maternity care of knowing about pregnancies.
Yes.
We can count the pregnancies, right? We know that, 17,000 births at PMGH last year, another 1,000 in the private sector, and approximately we estimate 3,000, 4,000 in the settlements or
Yeah.
outside the health system. So from that number of, say, 23,000 pregnancies a year, we can calculate the population, actually, because we know that there are about 34 births per 1,000.
Yes.
So we can extrapolate back and work out the population of the city. So we can have, but when no one consults us with regards planning, no one consults us. I mean, the CEO at the news conference on Wednesday came up with this idea, Centre of Excellence for Birthing at Gerahu. Hey, no got birthing lo Gerahu, no got mambla mamsisa karim baby lo Gerahu. And how by walking Centre of Excellence, or this lab where this is something does come up again. But no consultation with the mama's ONG specialist. You got plenty Centre of Excellence now. You got eye ophthalmology Centre of Excellence funded by the New Zealand government and PMGH. I think only been consult one time all eye doctor.
Yes.
Now walking this lab. And now you got a cardiac intervention, catheter intervention unit. Time will set him up this lab. I think only consult one time all heart doctor.
Yes.
All he must, Yeah, now you got renal too, kidney specialist unit where you walk already long transplanting one kidney or something, you know, one money or something or something. You walking yet, but you got this specialist unity staff where already staff this like kind of. I think only consult one time or kidney doctor, specialist, lo set him up this but lo set him up something long, Centre of Excellence long section long, Mama Karipini, no got consultation there. Because people are foul click. What's one name?
The advice and all that.
I mean, why not? Why not talk to you? Because I think it's because they have an idea of their own, and we might disagree with it. That's my one of the thing, and one of the things that we are at loggerheads of, also mipla, also pass thing long and maybe got one plan nice section straight or some ground or some buildings run down maintenance people need more capacity through needing more higher quality of care through but plus people start long and what they call him Susu Mama or McGregor Wing nice big hub where it's just perfect for a birthing and a women's service because we have trees, we have birds, we have access for families, grass, we have space. We're only on 1 or 2 levels, so Mama can come inside, or M can go out, or family can come inside, or can go out. All feel some carabus. And we have natural ventilation, natural lighting. We're not dependent on the kind power supply belong. This cities
on off.
Whatever shut down, whatever outage or whatever. Close to as we might be if we're in a tower block. And the management of PMGH wants to transfer us into a tower block, and this would make maternal and newborn care and women's health care dysfunctional. Because when you're having a baby, you can't walk upstairs, 4 flights of stairs and lots of our ladies arrive in quite advanced labor. And we don't want them delivering the baby on the stairs or something, where they're trying to climb the stairs. And then to have a labor ward on the 2nd floor, and then ward blown Mama Karim baby Pini sort of called him postnatal on the 4th and 5th floor. How on earth are we going to get them from the 2nd floor? Oh, the elevator, lift start, but power where? Generator, but fuel blood generator where? All at the time, maybe say run out of fuel, long generator. Medical school run out of fuel, and maybe say cancelling all big meetings. Every Tuesday we have the grand round, and it's been cancelled on many occasions this year because not got enough fuel, long generator and power's out. So this we have to have functional for our circumstances. We can't pretend we're in Sydney or somewhere.
Yeah.
You mean stabla Sydney, you stabla Papua New Guinea. Somewhere you stabla one in place. Time you open eye blue morning. Now you get up, yeah. Dream, yeah. It's very nice to have more sophisticated and more 21st century or up to date facilities. Yes, but they have to be functional and appropriate.
Yes. Yes.
That's a bottom line. And that's how we need to plan. And it's been an enormous disappointment for us in the maternity section of Port Moresby General when the Japanese government came with an offer.
That's right.
About 100 million kina to provide a facility that would both expand our capacity and upgrade our capability. Also, give more space and also helping people along. Walking more tertiary or something. PMGH like walking again there.
Yes,
and it was rejected.
Dr. Mola, when was that?
2022.
2022.
Yeah.
So all been come looking.
Yeah, no, man. Only 2021. Only make him offer lo government.
Yes.
Now only come you say, oh no, say come straight long. Like house or big house yeah. Time people like government or say Japan he come like helping PNG or say come the Prime Minister or Minister for Foreign Affairs now. Foreign Affairs Department look him. Oh yeah, nice to do yeah, thanks to that. Health call a Health Department.
Yes.
Health Department, oh yes, I think PMGH I like him kind of same, yeah. And all of a sudden only come along. So it comes through a diplomatic process. It doesn't just land on the facility. And so we got this offer in 2021 through these channels of government, and we started talking. It was COVID epidemic time, long moving about legally. So we started talking on digitally, Zooming, emails. And then in 2022, the travel restrictions were lifted, and 3 teams came from Japan.
Yes.
To help us do this planning. Very high-powered teams. I mean, we were just amazed actually at the sophistication. Hospital planner, quantity surveyor, so we get the pricing, financial person to help make sure we stayed within budget with our plans, architects, draftsmen, clinical specialists, teams of 8 or 10 really high-powered Japanese consultants came, and in between their visits in 2022, we had continuous discussions to fine-tune the plan.
Yes.
And we produced, we think, well, we don't think, we know actually, we know we produced a very good plan over 14 months. It wasn't a quick fix. It was a very considered, well thought out over time. Midwives were involved in the consultation, baby doctors, that's neonatologists, even the pediatric surgeons, because sometimes babies are born with problems that need surgical correction. The anesthetists, special anesthetists, ones that help us with pain relief and sleeping when we have to do operations and stuff. All nurses, all involved, and we had representatives from the facilities branch of the National Department of Health there that all lines looking health standards.
Yes.
You like building one health facility must in standards belong country.
Yeah.
And in fact, the PMGH sent the Director of Medical Services along to many of these meetings as well.
Yes.
And so when we produced this plan at the end of 2022, we were just thrilled that because the Japanese said, gets a board approval, we can build it in 12 to 18 months. And we know that when the Japanese say something, it's true because they built the PMGH as in 93, 94.
It was built by the Japanese.
Yeah, it's a Japanese-built hospital. It was built as a gift to the country for the 20th anniversary of independence. And here we are for the 50th anniversary of independence. And this was going to be Japan's gift for the 50th anniversary of independence.
How generous are
How
they?
generous. Yeah. I mean, the Japanese are very smart people. But they're very respectful and protocol.
They are.
You follow the Japanese way. There's no, like, you don't get the money and then 50 million disappears like Enga province. You know, the Enga province new hospital, there was a 550 million loan and 50 million sort of disappeared along the way. So they ended up not being able to furnish or equip the hospital. So the Australian government had to come up with another 50 million. So so it's now ended up as a 600 million hospital, but 50 million went missing. But Japan doesn't do it like that. And this was not a loan. This was a grant. Give not our president, yeah.
Wow.
Yeah, big was something started there. And we produced this tertiary plan with an intensive care unit for our women, because when women need intensive care, it's completely different to the general intensive care that we have at the moment. You know, the general one is like for snake bites, head injuries, heart attacks, strokes, all this kind something. Say go lo intensive care lo general side, yeah. But time Mary kissing bagarap lo karin pigin ini, nara plakain something or get we have a condition in obstetrics called preeclampsia, where blood pressure goes up and then you can get multiple organ failure. And this is a very different kind of intensive care requirement now. Or she can start bleeding because she's not clotting properly.
Yes.
That's called DIC. And that is a very specialist, different kind of intensive care problem to rectify a clotting defect in a woman who's bleeding. And then we can have, she can start fitting from the blood pressure problems. So she gets brain problems. Sometimes the lungs get full of fluid and she can't breathe. And all these kind of obstetrical intensive care requirements are completely different. So in our proposal, we put into the design an special intensive care section for mothers, and then also an intensive care for newborns.
Okay.
At the moment, we don't have an intensive care unit for newborns at PMGH. We have a special care unit, which is what I think the pediatricians call it level 4. But we need, for the national referral and tertiary hospital, we need level 5, neonatal intensive care unit.
So we don't have the intensive care for neonatal as well.
We're starting to try out in a pilot manner, but we haven't set up properly for this. And this project would have properly set it up. And then we were going to have a new labour ward that would provide labour ward birthing care at a much higher level than what we can provide at the moment. Because in a referral facility, we're going to get lots of problems in the labour ward, not just lots of women who haven't got a problem.
Yes.
So we need a labour ward that is more set up to deal with problem cases. And so that was also going to be, that was in the plan as well. And this, of course, would now free up the current labour ward to be another part of our facility. And we were thinking we'd convert it into a postnatal ward for problem mothers that would need more high-level nursing care than can be provided at the moment in the ward 11, the postnatal ward Imigat Pinislogan now. You know, the women who need surgery to have babies, or women who have very serious medical problems in association with their pregnancy. Time baby come out, in not some medical problem finish nothing. We have to now cope with the medical problem and the postpartum or some mama karim baby finish situation at the same time. So we need a higher level of postnatal. So this project plan that we came up with was in no way district hospital level as claimed by the CEO. I'm sorry. Now, it's okay. I mean, the CEO is an ENT surgeon, so that's where his professional expertise is. But one would think that he would seek advice from us before he goes and tells the board, reject this plan because it's only for a district hospital. Send them to Gerahu, was his suggestion to the, direction actually to the board, and that's what they did. They rejected the Japanese 100 million grant.
Yes.
And told the Japanese team, go and put your project at Geruhu. The Japanese team went to Geruhu.
Yes.
They looked at Geruhu, but there's no birthing unit at this hospital. How can we put a tertiary level plan or
project
onto a hospital with no birthing facility?
So it couldn't work out.
Well, they went and looked at it. This is ridiculous. I'm sorry. Bye-bye. You've rejected us. We're going back to Japan with our money. And people are saying, but the money's there. It's not there.
So they've withdrawn.
Yes. In 2022, they took the money back. And, of course, they felt, they were rejected, right? They were, when you offer a very generous gift to somebody, and it's been worked out as a really fantastic thing by specialists over 14 months, and then someone just rejects you.
It's insulting in a way as well.
Thank you for using that word, Josh, because I hesitated what word I was going to use, but they were offended.
Offended, yes.
And when you offend a very important, friendly, generous government, it's likely something here. Likely something. And so, can we get that money back? I don't know. But to do so, I would imagine we might have to apologize.
Dr. Mola, from the management, from the Port Moresby General Hospital management itself, I understand that the Chief Executive Officer, Dr. Paki Mulumi, has done some tremendous job as well at the hospital. What would you say about this area that is gone wrong or something?
He's a very good CEO. He's on top of things very quickly when problems arise, mostly. He's a good leader. He's a very smart person.
Yes.
And we've got a centre of excellence in ophthalmology for eye problems, and I'm sure he consulted all the eye doctors when that was set up. And we have a cardiac catheterization intervention unit now, which is fantastic for all these men, mostly men, who don't have a healthy diet and don't exercise and cause problems for themselves and get blockages in their coronary arteries. So they need stents and stuff to open up the arteries again. So we've got that. Yes, that's fantastic. And I'm sure the heart doctors were very much consulted and in on the planning for that one. And then we've got this renal, specialist renal unit where poor things that have failed kidneys are getting dialyzed, and we're planning to transplant a kidney or something into one of them or something like that. And I'm sure the kidney doctors were all very intimately involved from square one on development. But with the birthing centre of excellence at newborn, we are not consulted. And we were consulted on one occasion, and we gave our view, and it was completely ignored. And we don't know why this is happening. I think it's because I think the hospital management has their own vision. They have their own vision, and part of the vision is that they will take our site.
Yes.
The Susumama site.
The Susumama,
it's the best site for women's and newborn and women's health and birthing centre because it's quite expansive. You've got big Plahab area, plenty space, long old family too. You can come inside, go come. People got two gates.
Oh yes.
Long all can come inside. Ambulance can come inside. You've got space, access, but their vision. Master plan is to take away our site and build a hotel and a shopping precinct. Now, why? We've got Shady Rest Hotel just across the road. We've already got a hotel within 100 meters. away. I don't know, why do we... Some lady told say, because you need him Medi Hotel, them kind of hotel where line blow Australia by come sleep long and na kiss him healthcare blow lo here.
Oh.
Huh?
Uh-huh.
Philippines so too bolikam na. No good all Malaysians na, Solomon Islanders, Fiji too bolikam na, sleep lo hotel na. Kiss him specialist healthcare lo PMGH.
Really?
Really? Yes, I mean, really? I think not line by cam, yeah, sorry. But Fred too, yeah. Dangerous. Hey, we talked about the WHO, I stay long. People are like working on the legal research project. Don't talk. Hey, he must go on time. Police escort. Hey, police escort. No, just ask him something, mama, lo, ting blong, lo. Yeah. I think if you ask people in our neighboring countries,
Yes.
would you like to go to PNG to have your heart fixed up or your cancer?
Come with the second thought, yeah.
I think Mami go to Singapore, yeah. I think it's a slightly ridiculous idea. And then a shopping precinct. I mean, Manu is up several 100 meters low east, and Foodland is up several 100 meters low west. And suppose you like him big black kind something, well, club the bus and go to Vision City. But people don't need him Harbla shopping precinct long a rail house secure place. And besides, we need the hospital land for hospital development for the future. And this is where we should be building the Vision 2050 women's and children's standalone specialist hospital.
That's
that's in the Vision 2050. We're not going to be stuck in a tower block over near the morgue on the west side of the hospital, jam-packed against all the other tower blocks, please, because that would be completely dysfunctional for women's and newborn care. And that's our advice to management, and they are choosing to ignore us. But we will persist because we believe that's the best our best advice.
Yes.
If we see that circumstances change or we get more information, of course you modify what you've considered to be the best advice. But the best advice at the moment is that we keep our sight, and that's where we start developing the women's and children's standalone specialist hospital for our country.
Dr. Mola, of course, you've revealed something in the master plan or the overall plan, grand plan that the management has come about with. I'd like to bring as well your opinion or your say on the issue with the you have a staff operating under you that is being stressed out physically, mentally, amidst the daily occurrence that happens in the hospital or the maternity ward. How is how are you dealing with your staff so far?
Well, the hospital, the management has been quite good in helping us get more staff recently. I think the government has given more money for HR support at PMGH, and the nursing boss, the director of DNS, Director of Nursing Services, Sister Nicholas, has liaised with our nursing managers, and we've been able to recruit more staff. But these are fairly inexperienced people. They're new graduates by and large. And we're having to teach them and upskill them and all that sort of thing. We're trying to do that, of course. One of the things which is a really big obstacle to healthcare these days in urban areas is the mobile phone screen. Staff sit down gazing at their mobile phone screen instead of looking after the patients. Now, that might be okay in psychiatry or the kidney unit or something, but in our section, things are happening really fast.
Split of second,
women are having contractions every 3 minutes, and the baby might get distressed at any moment, or she might bleed, or the baby's coming out, and to walk into the labor ward and find half the midwives gazing at their mobile phone screens is very irritating. I'm sorry. Just employing more nurses. We need supervision and discipline and a culture of caring for your patients, please. And by all means, watch your Facebook page or play Patients or whatever you do on your mobile phone screen during your lunch break, but not while we're trying to look after the patients. And I'm getting a bit tired of telling my colleagues, can you put that phone away, please, and look after the patients? Wow. And in fact, when I get really irritated, I take the phone out of their hand, I confiscate it for an hour or two.
I mean, thank you for highlighting that issue that has been ongoing there. I believe from the hospital management, is there a policy in place about this? Addressing this. Social media policies or something like that.
Sorry, I'm actually not sure on that one. There are policies in place like tambulo kagay buhay.
Yes.
Inside the workplace, inside the Paris Flausi. Tabulo smoke, tabulo making some kind but this is a new thing, isn't it? So is there a policy on mobile phone use? When I speak to the other supervisors, like the nursing supervisors, and they say, you're not meant to be just on your mobile phone during working hours. But I don't know whether there's an actual policy. Perhaps we should take that one up.
Yeah, definitely. I think that would be really.
Yeah, but I suppose this might be a way of staff dealing with their stress. You mentioned when you've been working flat out and really high intensity clinical circumstances, and some of the women are making a lot of noise, of course, because they're in such pain.
Yes.
And that's quite stressful. And so this might be a way that some staff are just helping to calm themselves down and take a breather from the stress of having to look after these very challenging clinical cases. So, we can't be completely... but I think you should take your break and you go outside to the tea room or something, and you don't sit at the sister's station where you're meant to be observing the patients on your mobile phone.
Thank you. Dr. Mola, for turning our attention again on those who are mothers, of course, and women. Some of the things as well that you make mention, of course, prevention is better than cure. Probably more applicable to the medical fraternity itself. When you talk about that, when you talk about pregnancy and the process of giving birth and all that, we got to look back at the root of that.
Like family planning.
Family planning.
Exactly.
What's your take about that?
That's one of our main strategies of prevention, of course, for pregnancy problems. Because if you don't get pregnant, you can't have a pregnancy problem. If you don't get pregnant, you can't be a maternal death. You don't get pregnant, you can't have a dead baby either. So, preventing having the pregnancy at the right time for the right number that you can look after.
Yes.
Well, and of course, when you have a baby, it's not like just susu baby lo 2 years na woki pedis. No idea. You karim piginini, but you're responsible as a piginini for 20 plus years. Because piginini by walking grade 12, time maybe 18, 19 about there. And then no go them by like got a POMTech, come up mechanic, carpenter, metal worker, no go them by go to PAU because them like come up journalist or nurse. 23,000 a year, I think.
School fees gone up now.
No good them like come up geologist or something, go to Uping. School fees, compulsory fees like 5,000, residential fees down to 10,000. And big money started there.
The responsibility continues.
It's a very parenthood. Like something, and maybe a long section long. Look out, mama. One of our standard conversations. With our clients is so YouTube Mandu David or is that there? Think like him. How much pikinini law family? And I did this morning. I was on duty last night, so I finished at 8 o'clock. So at 7:45, I was talking to this young Enga lady, and she said 4, and she was having the third one, I think, And I said, my friend, you walk me? No, I'm Stablaus, yeah. And so man blue, yeah, man blue walk. So I'm saying, how much kina, 500 kina? And I thought, friend, 500 kina, and by sort of buy him school fee long, two plapigini. I think, ting again, please. 4, no go them 2 months lick. You can't just have kids to fill the house. You mean as I come up in Picanini, or help him mama, or broom him house, now walk him laundry or something?
Yes.
You mean come up in Picanini, or give him best chance, or just like Picanini, or come up wanting something, big money, give him capability, or make him just like around there.
Yes, yes.
So you have a responsibility to God, actually. It's not just your kid. It's Picanini, big man too, yeah, where you got contract, look out him. So I think we need to have our pregnancies in a planned way at the right time in our lives. You know, there are so many young people coming into the city every day.
Yes.
And they arrive on buses on the Magi Highway and the Hiritano Highway, and they come down from the Sageri Plateau, and they come up to Balus, go down to Jackson's Airport. My goodness, plenty long all young player. Only come down long when them bus or balus or when them, yeah. And then next week only got one player boyfriend or girlfriend pinis.
Yes, yes.
And then next month only bell pinis. And all married. And then people are looking more now long 8 months later, long antenatal clinic, because also come late, yeah, because it's an unplanned pregnancy and all same lick.
Yes.
And so they come late to the antenatal clinic, so we don't provide proper antenatal care to prepare them for the birth. And then they come into the labor ward, now only no ting, lo. How about me look out him the pig in? How about one family planning by me kiss him now, not gonna kiss him bell again long, this year or next year about that. So I think, you know, when we had the HIV epidemic starting in the 90s, there were big notices at the airport and the bus stops.
I remember.
Yeah, safe sex. Nogan Kamlo City na kisim sik, yeah. Abstain, ABC, yeah.
ABC, yes.
Talk, 90s, you thinking,
ABC 1 to 3.
A, abstinence, B, be careful, using condom, C, condom, yeah, there's like, yeah. And then when we had the COVID epidemic, 2021, about the big plan notice, place Badus again, organ a bus stop, kiss him vaccination, give him strong body blue, or not gonna die of COVID, put him mask, distance, not gonna go stand up close to the narrow line about that. You think him, hey, kind health advice, yeah. I think now you must put him. Now, I kind notice the place balus na bus stops. Come lo this la city na not gonna kiss him bell. Plan him first pregnancy, play you. Go to nearest family planning clinic tomorrow, and use him protection, safety, long kiss him bell on time you married pinis, because there are actually 23 public clinics in the city.
Yes.
And I think for most people, you can walk to one in a few minutes from where you live. And then Dr. Robert Oggy, the CEO, told me, we were at this media conference together on Wednesday. I sat next to him, and he said, yeah, we've got 23 public clinics in our city, and plus a few church ones and a few lots of private ones too.
Exactly.
I think not got hard work long. Family planning and free, yeah. Free straight. You go to one government family planning clinic, you can kiss him free condoms.
Yes.
No, I talk too much. Well, nursing not ask him you why now you like using condom, yeah? No, not there. No, not ask him you. You ask him long free condom, or must just give him you, yeah. You like him brother blah you, or you like him susa blah you, or you like him piggy walk him balloon or one of something. You might go walk him long. Need blah you use him condom. But just give him you that's all. And suppose girl go and ask him long implant or depot shoot or some pills about there long. Less look him bell because it's like new boyfriend walk the strong walk at the night was like idea or one emana. Less look him bell because tubly no married yet. Well, I'll nursing not ask him why now you like his in family planning or something. Are you married or it's like him kind talk before he threw. Some nurse make him use a kind talk. But now no got there. And if one nurse is offensive in that way, please report.
Yes.
And that nurse will be disciplined, because the national family planning policy is that every adult citizen of our country must have access to family planning so that we can plan our pregnancies for the right time and in the right number for our families.
Thank you for that piece of information, Doctor. We'll take a look at some of the messages coming through this morning. Dr. Mola, Ivan over at Gordon's, Ivan, a regular on the Nasfund FM100 Talkback show, saying, Daba namona, Dr. Mola and Josh. It's a pleasure having Dr. Mola on the show this morning. I just want to take this opportunity to thank him and his team for attending to my wife's operation about 5 years ago at the ward. She is good and healthy. Many thanks. Now, could the doctor elaborate on the JICA-funded clinic? Is it true that the Port Moresby General Hospital board and executive did not decline this project? And did the chief executive officer of PMGH say this in his recent media statement? What's happening? Nobody's taking responsibility. We've touched on that a bit earlier on.
Yeah, we did indeed. But I think the CEO said something like the money's still available. That is actually not so. We have been in communication with JICA through inquiries, but we've also heard on diplomatic channels from the New Zealand and Australian aid. Australian has, what do they call, DFAT, and the New Zealand aid, and we used to have USAID before Donald Trump, but now he's abolished it. And so we've heard through diplomatic channels that the Japanese have taken the money back to Japan, but Japan hasn't. I'm sure we can see we've got a new ambassador right here.
Yeah.
I haven't met him yet, but I was told by a Japanese professional at WHO yesterday that he's a person who's very interested in health issues.
Yeah.
And so I'm sure Japan, being the really good, friendly neighbor, is not anti-PNG just because they were offended by one episode of inappropriate. I would say that their project was misrepresented.
Yes.
Misrepresented to the board, and on the basis of the misrepresentation, the board rejected and sent them off to Gerahu, which was inappropriate. And when they went to Gerahu, as I've already said, they saw that it was inappropriate, and so they returned to Japan with the money. But that doesn't mean Japan's going to stop helping us. I'm sure of that. They are a very friendly, supportive neighbor.
Yes.
So I think, if we do things right, we might be able to get a sort of JICA plan back again, because we certainly need it. Whether Japan, Australians might, the Chinese might help us, but the PNG government, of course, might do a kina for kina. I don't know, but we need that kind of plan back again to provide more capacity and higher level of care for mothers and newborns at Port Moresby General Hospital. But at the same time, we need the primary and secondary care services in the national capital.
Yes.
And I hear that like John Cowper is building, or 9 Mile District Hospital, and of course Chichenko is building district hospital at Kila Kila, and we've got the Metaraya clinic that was opened. It was a DFAT project at Anuabada a few months ago, and they're doing some birthing too.
Yes.
And Gerahu eventually has to have a birthing service, but it needs to be a primary and perhaps basic secondary care service. And then the governor of NCD is planning a level 5 hospital at Tene Settlement.
Yes.
But I mean, this is years down the track, right? Yeah. We need something right now. And Metaraya Clinic has 1 birth per day, and we have 50. So they're not taking away much of the load. And then I suppose the Kila Kila might do 1 or 2 births a day, and perhaps the 9 Mile District Hospital might do 2 or 3. And we're still going to be left with 40 a day that we have to be able to cope with. And the current, as I mentioned already, the current facilities are fit for about 10,000 only. So even with these district hospitals in the foreseeable future, we're going to be still overloaded.
We'll take another look at another message here from Matthias at Downtown. Matthias saying, "Good morning, Professor Mola and Josh. I want to take this time to thank Professor Mola and the team at the Labour Ward for doing a wonderful job in making sure that mothers deliver properly. One thing I noticed when visiting the labor ward is there a less number of beds and the rundown facilities. The labor ward at the moment cannot cater for the high number of deliveries. Many of the time, pregnant mothers have no beds to deliver on and are forced to deliver on the floor, which is not safe for the mothers and the newborn babies. I see it's a big need that something needs to be done quickly as possible. Government, the chest beating by spending billions in Connect PNG program and totally forget about hospitals. The government needs to set their priorities right and build a labor ward at the Port Moresby General Hospital and other centers in the country. Something we've been talking all morning about it.
Yes, you're right, my friend. You're absolutely right, and that's why we had this wonderful plan to help with this issue. But the DMS of our hospital, Dr. Sobi, day before yesterday, said, "Can you help us work out an immediate plan for using the facilities we've got right now in a more effective way, so that we can mitigate the problem immediately?" And so we sat down and we worked out a plan yesterday. We're pretty fast in ONG because we have such fast patients. We have to be fast with our work in every way. And then a medium-term plan, which basically is get something like the JICA plan back. And then a long-term plan, which is the Vision 2050 for the standalone women's and children's specialist hospital and all the other facilities in the national capital to provide primary and secondary birthing care. And so we submitted this to the management yesterday, and they're looking at it, and we're hopeful that they will cease their focus on terminating us from the McGregor Wing site and trying to put us in a tower over next to the morgue on the other side of the hospital, and that we will collaborate in producing the best that we can do with the money available. We're hoping that Japan will come back. We're hoping that there'll be other donors. But yes, the PNG government also needs to have a focus on hospitals and provide co-funding for all this stuff that we need. Yeah, thanks, Josh. Please, all you bigwigs, bossman, VIP, leaderman, about harim mipla all line got save good law. This la walk here law. Got him all merry long kind problem long all long preventing problem long all na. Helping more time only got problem pinis na. Walk from me walk him some me walking 50 years pinis na. All not my colleagues from me all some 10 years pinis. Dr. Bagita, I'm coordinator from me 20 years pinis. Hey, me got plenty experience, and me got sabe long. How by me plan him good facilities long national capital play me for the future. So we're ready to engage with you in the PHA of the National Capital District. Dr. Robin Oke, thank you. Really great new CEO there. One of my best students, I'd say, from the early 2000s, and now he's the CEO. And of course, there's Dr. Michael Dokup, who's the clinical deputy in charge of clinical services, and he has a deputy as well, who is a surgeon, Dr. Siwi Wawe. And these we really want to collaborate in giving you the advice. Of course, you will take advice too from the National Department, and then the finance people will tell us what the limitations are, and we'll all put it together for the best plan. But just because you have a particular vision, perhaps it's not perfect. You know, our service is different to some of the other. We're different to psychiatry. We're different to internal medicine. We're different to ophthalmology, the eye doctor. We're different, and so we have different clinical service needs, and so the planning for us to be functional and effective needs to be different.
Right. So
please listen to us and vary your own vision to. Can we come to a consensus on what is best? Perhaps the shopping precinct could be well, there's a site, isn't there? There's a site just across the road between the St. John Ambulance and
yes.
PMG. Hey, nice habla walking mobla shopping precinct or hotel or something, yeah.
Sure.
Suppose you must walk in this lakain, yeah, along close to Long Housik. But this la McGregor wing site here and best sites threat long Mipla Walkim Vision 2050 standalone women's and children's hospital for the future. So that's my message. Let's work together on this one. But for professional advice, listen to your professionals.